Okay, well, good afternoon, everybody. This is our second webinar. I can't believe it's already November, but the purpose of this webinar is to explain what our next steps are, what to expect at the training, and to also review what homework you will have to bring with you to the training in December. So let me see if I can advance my slides. Oh, there we go. I guess I have to have it on it. So we're going to, hopefully everyone has access to speak to us and everyone's off mute for the next slide. Like I said, review our timeline, homework that we'll be discussing during your TA calls additionally to this, so don't feel so overwhelmed. Timeline and tools guide that will really give you the full guide of what's coming down the pike the first year. And capacity homework and assessment tools in first quarter training, and then any questions you have. And like I said, we can answer those questions now, but if you happen to see that you have some questions after it, we will be having the TA calls, or you can contact me either via phone or email. I am at your service. So I'd like to start off, if we can. Everyone's used to seeing this map.
Let me chime in. And we have some reports of low volume. So if you could speak up just a little bit, it may help.
Oh, okay. I'll try to get closer. And it may be that I need to call in on the phone. Is this any better? Can I do a sound check?
Yeah, for me, it's a tad bit better. I'll keep an eye on everyone else, just in case if it reoccurs again.
Okay. Okay. So introductions, I am hoping everybody can say hello and then just name one success in your work so far with PFS. It could be that you've completed the homework, the first homework assignment. It could be that you've already, hired someone. So I'd like to start with Dare Casa. I understand Patty is, I'm not sure if she's with us yet, but she had a meeting that was going to run into this. So if we can start with Amber of just saying hello and what counties, well, it's Dare in Currituck. If you can just introduce yourself and give us one success.
Hey there, can you guys hear us?
Yes.
Okay, this is Amber Griffith with Dare Casa. Primarily, we had served Dare County in the past, but this funding will allow us to broaden our scope. We'll be working in Dare County, in Currituck County. We're really encouraged. Pre-award, we've been able to connect with the sheriff in Currituck County, some administrators, and some folks that work with some youth-serving organizations that we're really excited about the potential funding for us to expand more formally into Currituck County. And now that we have the award, we're excited to get started.
That's great. Thanks so much, Amber.
Thank you.
How about McDowell? They want to give us a shout out?
Hi, this is Donna with McDowell, Donna Bruce. And I think our success is the fact that we have the sheriff's office, the police department, the schools, the health department, and recently, mostly the YMCA there are all on board and eager to work with us on this project. So I think that's a real success.
Great, great. Thank you. How about Onslow Carteret?
Hi, this is Kelly Matt. Some successes so far. We have hired a coordinator. We have begun the process of kind of laying the foundation for what we want to do. We have some excellent working relationships both with the military as well as our two local task forces in each county for abuse prevention. So we're just waiting on our contract and eager to get started.
Great, thanks. Okay, we'll throw it back over to the west with Avery.
Hi there, can you hear me? This is Gretchen.
Yes.
Hi, we are super excited that we have just hired our new coordinator for Avery County. and she will be starting on December 2nd, right before the training. So we are very excited and awaiting our contract.
That's great. Good news. Okay. How about Wilson County?
This is Jeff Hill with the Wilson County Substance Prevention Coalition. I hope you guys can hear me. So far, successfully, we have gotten back with the public school system about our fraud survey distribution, so we're really excited about that for the data point going forward. We had the job description that's been distributed for our project coordinator, which hopefully we will start interviewing for next week. And we've just really continued the data collection piece and trying to really disseminate where we want to target and what we want to do as we move forward with the process. So we're very excited.
Good. I like the excitement. Now we'll send it to Charlotte Mecklenburg.
Hi, this is Melanie. We are currently reaching out to Johnson C. Smith to get volunteers. We have gotten volunteers already from UNCC to help with what we're wanting to do. We're expanding our alcohol purchase study into the Johnson C. Smith area. And also we will be doing a vaping purchase study as well to see if we can get a grasp on if stores are willing to sell without IDing.
Okay, thank you, Melanie. And Johnston County?
Hello, Virginia's here. We have been working on, we've had several coalition meetings at this point, so we're very excited. We have a lot of community partners on board. We're working with trying to get more law enforcement on board in Johnston. We have our a job description out for a coordinator, so hopefully we'll start interviewing, and our goal is to have someone on board before the December meeting as well. So we're keeping our fingers crossed for that. So.
Great. And do you want to also talk about Fuquay Varina now that I have you on?
Sure. Fuquay is a probably very similar spot as well. They have been an established coalition that has been revamping, and so they've had several meetings as well. They're super excited about this, and we have a part-time coordinator there as well. She's been there working mainly focusing on underage drinking for years, but we are looking for a full-time position for a coordinator in Fuquay Varina. And again, the job announcement's out, and we're hoping to have someone on board by early December. So
great. That's good news. Thank you. And Forsyth.
Hi, everyone. This is Aishan Parker. I am the PFS coordinator. So some successes that we've done so far, we have completed the homework, and we are building capacity with local community partners.
Great, and welcome, because you weren't on our first one, and you've been hired since, so that's great. Super. Okay, has Patty joined us yet from Haywood?
I have.
Good.
Yeah. I'm sorry I didn't hear what we were supposed to tell you, just to update you where we are.
Yeah, just name one success, whether you've advertised for the position or what's going on in Haywood.
Yes, actually we had 2 interviews yesterday for the position, and feel very blessed because one of them actually had experience in tobacco prevention. So we're going to try to have somebody on board by the beginning of December as well.
Fabulous. I love hearing all this stuff. Thank you so much, Patty.
Mm-hmm.
Okay, so let's move on to, let's look at what we've done. It probably doesn't feel like you've done a lot, but you have. I mean, you were awarded the grants. We've done our introductory webinar, and I'm thinking about, of course, my timeline. It seems like it's taken forever to get to this point. And we did send out the homework assignment last week, and we're in the process, you all are in the process of hiring coordinators, or already have. So everyone is working quickly. I know how difficult it is. I've been in that position before, trying to hire someone with, within a month or two. So, and I appreciate the folks that have sent in the homework. We really need to, to try to keep those sending in, and we will be, as we'll talk about later, we'll make it easier for folks to upload them into a platform. But we haven't reached that point yet. So when you send them in, I have folders that I send your emails to, and then I have files where I upload your documents. So I really appreciate Forsyth, Haywood, Wilson, Angela Carteret, and Avery. And some of the highlights they pointed out, and if I didn't mention your name and you sent it in, please let me know. But some people that need some booster shots in the areas of environmental strategies, health disparities, community capacity building, how to report and document your work. We're going to be learning that in day 2 of our first training, and then strategies on preventing e-cigs. And many of the successes I've heard are a great deal of community collaboration, capacity building, relations with law enforcement, and having the community recognize that there is an issue with substance use. And then some challenges are lack of TA, limited resources, and I hear that all the time. Communities may be more focused on treatment or harm reduction, so they don't get what primary prevention really looks like. Lack of diversity, and a little challenging to get some reliable data because maybe the school systems don't see why this data is necessary, and they're not able to either release the data or take part of a survey. So that's some of the feedback I've had. So thank you for that. And we'll be discussing that more thoroughly during our TA calls in November. And I still have 3 slots left for, and I've given you a few more days on signing up, but please remember to choose the day and time that you'll be talking with me for the next 4 years. So we'll, like we said, we'll have these monthly TA calls, and that's just for us to, get to know each other better, get to figure out where we are, what needs you have, so that I can either answer the questions or take them back to the team. So what's on the horizon we'll be working towards filling out our capacity worksheets. We'll be doing assessment collection. And of course, our training December 3rd and 4th in Winston-Salem. And I believe we do have registration for that. Jamie, do we have a hotel set up for that yet?
We do. It's the,
okay.
Courtyard by Marriott.
Good deal.
Trainings, and just make sure that you indicated yes, no, or hotel needs during the registration process. If you're not sure if you answered yes, no, one way or the other, you can just let us know and we'll coordinate that. But we take care of the, from your registration, yes, no, in terms of hotel needs, we take that and set up the room block and register your room for you in advance. Then you will receive a confirmation number from John Elmore prior to hotel stay. If you have any questions about that and you're not familiar with how we usually take care of those types of business items, just let us know, and it'll become second nature sooner than later.
Thank you, Jamie. And then along those same lines, we'll be having our second quarterly training in February, the 18th and 19th. And that one we're going to hold in Raleigh, because we realize we have Haywood on one side and Dare on the other side. And what we've determined is actually Burlington is the center point. So we thought we'd do one in Raleigh and possibly do our April training in Burlington. But when we get together, we want to hear from you, what works best for you. So let's look at the homework. We've already, like I said, people have already completed what 5 people have already completed what they needed to have completed by yesterday. I'm still waiting for 5. And we'll discuss those more. If you have questions, if you look at that and say, I don't know what you want, give me a call or try your best to work on that. And then during our TA calls, we can review that. It's just to figure out where your coalition or your agency is, what your needs are, what I can let the team know, what is working, what isn't working with PFS, so that I can relay those to the team. It's not just Basil and I working on this. There's a whole team of us, so Jamie included. So, and really the PFS is focused on the SPIF process. And in order for us to follow along, we have some specific tools that guide us through the process. And we also have worksheets that will be handed out for homework, will be introduced during some trainings, and then maybe given out to you additionally. So this is what the process, really the SPIF is leading us through that process. And then we're coming up with tools and guides to get us through the process. So I'm sorry, my son just let me know there's a loose dog. So got to bring the dogs in. So the PFS community timeline and tools guide, don't let it overwhelm you, because we figured through, came up consensus-wise that I know that I'd rather see what's coming down the pike so I can gauge what's going to be needed. And this is what we're going to be sending out tomorrow. I'm sending out everything that we're showing you today. Tomorrow, I want to make sure there's no typos, that everything is ordered. We've had many eyes looking at this. Like I said, we're a team. And so tomorrow I'll be sending out a packet with all of this information. So this basically, the timeline and tool guide shows you what you're going to be doing, gives you a checklist, so that I know I'm a check-off person. I like to be able to check a box and say, I got that done and that's flowing into this. Okay, cool. So this is what's coming at you. At first, when I first saw it, I'm like, oh my gosh, this is overwhelming. But I think you all will have a better idea. So one piece of homework that we want you to do pre-training is the capacity toolkit. So when you get the toolkit, you will know that if you want to take notes now, that you'll need to do resource assessment on page 4, and I will be sending this out, and then analyzing your existing partners. Who do you have at the table? And I'll be pulling this document up so that you can see this, but this is one homework assignment regarding capacity. And then the next piece is the assessment piece. What data do you need to collect between now and training, December 3rd and 4th? We want you to show up with your assessment, some of your data collected, not all of it, but some of it. And so tomorrow you'll be receiving the assessment toolkit, which is basically, you can see the table of contents. We look at consequence data, consumption data, and intervening variable data. And that is what we'll be collecting, but not the intervening variable, just the first two. So this toolkit is to really lead someone through that has never seen this before. What do they mean by this? And so what your homework will be is to and I'll also be sending you this. This is an analysis spreadsheet. Your needs assessment. So what substance are you collecting? Where are you getting the data from? When was the data collected? So we're looking at archival data. We won't be doing the primary collection data right away, the person-to-person data. So we want you to see what's already out there, what already exists. We are also going to be sending you some data just from the state, but then there's other data pieces that you can get from law enforcement, from hospitals, that type of thing. So what are you finding out in your neck of the woods? And I'm going to show you the homework now. Bear with me as I pull information up. So this is the capacity. So this is page 4 that you'll be working on. So you can see it's resource assessment. What are your human resources? Who are they? Who, where? We give you the directions. But during our TA calls in November, we will be going over this. And I know we only have an hour. It's 1:25 now, so we're doing quite well. But I know you guys, I'm not a great learner over webinars. We're trying to make this as easy as possible. And then page 5 is, okay, let's see who you already have at the table. And when you do this, there should be a click down box. So you don't have to think about the sector. You can pull down from one of these and say, well, it's media, the nature of the collaboration, the resources that you're getting from the media. It could be the nature of your collaboration is that when you send out a press release, they bring you in on their morning show. And then level of involvement. How involved are these folks? Are they not involved? So maybe we need to reach out to them. Are they networking? So yeah, we're telling you what we're doing. We're spreading the word through you. And then all the way you can see the different ones, coordination, cooperation, coordination, and then collaboration. Are they actually sitting at your table and planning the events with you? Or are they coordinating when they do an event, they invite you to maybe table or maybe do a presentation? In cooperation, when they're working together, they're letting you know what's happening. And so filling these out, we would love to have page 4 and page 5 filled out, and please bring with you to the training. The other, I did mention the assessment toolkit. So this is the first page. And I don't want to make people sick, but there's my name. So if you need, this is the table of contents. So for those of you that might be just listening, the data sources, what you'll be collecting, 3 different types of data, the data gap analysis, resource assessment, what resources do you have? And a lot of this you can be, going through and learning from it. And then also looking at what kind of data you might need. And then this is, I'm showing this page, it's during and post-December training. You'll be filling out, answering these questions. And so you see this whole toolkit, it will become your assessment Bible and sort of guiding you through the assessment piece. Assessment is really our foundation for what we're doing. And so when you fill out, when you get the spreadsheet, it's the needs assessment analysis Excel spreadsheet. And so if you look on the bottom, we have the sheet for instructions. The next one is consumption and consequence data that you will need to please fill out before training 1. And then this we'll look at later, the intervening variables. So those really right now, all you need to be concerned with are the instructions and the consumption, filling out this spreadsheet right here. And like I said, if you have questions, there are plenty of people that can answer them. Direct your questions first to me. And if I'm stuck on it, I will take it to the team. Take it first to Basil and then to the rest of the team. So, does anyone have any questions? I know I've been going through my spiel, and if anyone has any questions immediately, or if you feel more at ease calling me later, I'll be available for the rest of the afternoon, and then also, like I said, during our TA calls. Any questions so far? Are we good? Okay. So now I want to talk about our first training and what you need to bring, like make a list, your consumption and consequence data. Bring your laptop, because during the training, you'll be filling in. You have, would rather fill it out via hand than print out the material. I just don't have enough ink in my home computer to print out everyone, a copy for everybody. But, or if you'd rather work on your laptop, that's also a good way. But please bring the laptop anyway. We'll be looking up data sources, sharing information that you have found during your search for consumption and consequence data, and then, bringing those assessment tools that we've provided you and sharing those. And as everybody knows, we always, on every evaluation that I get back from something I've worked on, the temperature has been crazy. A lot of times it's really hard to vary the temperature. The temperature is going to vary. So bring a sweater or a blanket in case it gets cold, wear layers. And then also bring our questions. Bring your questions to us. We will have our trainer, and she will be able to answer questions. Jamie will be able to answer questions. Basil and I will be there. So, and then ask other people, like you all, everyone is an expert. And so we can spread the wealth. I want you all to be wearing your expertise hat when you get there. And so just a quick overview of what's coming up in the training. Day one is working with the trainer and working with the intervening variables. We want to figure out, why is underage drinking happening in your community? Why is vaping? Why is cannabis use happening in your community? And we're going to be looking at, on top of that, disparities. So we will have a disparity tool. It's actually focusing on, okay, what populations have you identified through your assessments that could have a higher risk of using these substances? What health occurrences are happening? Is there more cancer happening in a certain population? How does that, what are we finding? Is there a link? And so we need to drill down. We're aiming at drilling down even further. We're aiming at our subpopulations, not aiming at them, that came out terrible, but we need to aim at our problems that are associated with lack of resources, lack of education, too much availability, and then we'll be using those tools to collect intervening variable data and really thinking that through. We're making sense of the consumption and consequence data. That's what we're going to be doing. And on day two, we're going to be working on the data collection and compilation, so easy to say, in the spreadsheet. We're going to be determining potential communities affected by the disparities. We're really focusing on day two being a working day. And so sitting in groups and going, okay, this is, if you can bring someone else with you, if you have it in your budget, then you can work as a team. And creating your community's health disparity statement. SAMHSA needs that, we need that. And so we'll be bringing another tool that is showing exactly what we need to document. And speaking of documentation, Jamie will be giving an overview of what we have, our new platform. So instead of, sending me an email and, oh, did I really send that email? Did I hit send? Losing the emails, you can upload your homework into your own file. No one else will have access to that file except for me and Jamie, so that, DARE can't look at, Avery and say, oh, I'm going to copy what they have. That wouldn't happen, Amber. I don't think you would do that. But it'll be your personal workspace. You will have to work on it and then upload it. You can't work with inside the platform, but Jamie will be having a much better description of the platform during day two. And then we'll also be really kind of sitting around in a circle and coming to terms with, wow, what is PFS all about? How is this really going to be different than anything else North Carolina has really done? Because it is going to be different, and I'm really excited about that. I hope you all are. We'll be meeting new people. We'll be seeing where, you know, if one community has done well in one effort, they can share that. Post-training, we'll be really focusing on the data collection, on the intervening variables, and also the disparity work. When we think about capacity, who else do we need to bring to the table? That note that was on the capacity sheet, who else? Me as a white, redheaded American girl, woman, walking into an Asian community, I probably won't be the person that would be best to ask questions during a focus group. It would be better if I had a key stakeholder that was from that subpopulation. So we need to find out who else is working on health disparities. Should they be on our team? So that we don't have to start from scratch. We can work with folks that are already in that population.
Elizabeth, we do have a question from the audience.
Sure.
Patty asked, will supervisors be able to view the information put into the system?
Yes, I mean, it's up to you and how you supervise that person. That person that is the coordinator will have the link, will have the password, right, Jamie, to get into their files. So you just have to make sure the person you hire is going to share that with you. So you'll have to stipulate that.
We will be asking all the grant contacts, the primary grant contacts, or actually be asking Elizabeth to provide us a list of individuals who need access to this system. So in some counties, that may be one person. Or for example, to answer Patty's question, you may request 2 or 3 accounts, and that's okay as well. So whatever we need to do through Elizabeth and the supervisor inside the county, we can make that happen. You're not limited to one account, but we do want to provide some training in terms of the system at large and identify a primary person who's primarily responsible.
Perfect answer, Jamie. Thank you. Jamie is our platform technical guru. So ask him. A good takeaway, Jamie. Post-training webinar will be scheduled after, we're looking at January to have the health disparities webinar so that we can get more information. As I said, looking through the homework, some people are realizing that we are digging deeper and we might need more help, more assistance in this area. And so from now until December 31st, I'm so excited to hear the progress of hiring coordinators. Some have been hired, some are getting hired. Please, once again, sign up for a TA call via the doodle poll. I did send that out. If you did not get that, then please contact me. And this webinar is taped, and my contact information is actually in the homework. So not at the webinar, but in the homework, not in the PowerPoint. What you're gonna have to start doing starting tomorrow, once you've organized everything, is really doing that assessment, the data assessment tools and capacity tools. And what I would do before even trying to fill those out is familiarize yourself. I mean, I'm going to admit it's even confusing with me with all the paperwork, but once you read through it was when I first got it. But once I read through the toolkits, I said, oh, I see where everything is fitting in. And these are fluid documents. Don't complete them and then stick them up on the bookshelf, because we'll be changing those. Next year, you might have new data that's been updated. So you'll be updating those continuously. Like I said, we'll be meeting in Winston-Salem, and I'm going to be sending out a time to meet face-to-face with me, so we can have a TA training. That will be your TA training in December. So we won't have to have calls unless you want those. And so I know December is a busy month for folks. I am scheduling trainings on December 2nd if people get there a day early. So these scheduling TA meetings, they're only about 20 minutes each. I'll be scheduling, like I said, on December 2nd, the morning of December 3rd, and the early evening of December 3rd. So I need to meet with all 10 coordinators and anyone else that they bring with them, so that we can get a feel of how people work, how things are going, what challenges. Like I said, it's just a face-to-face TA meeting. And then begin, tomorrow, after the training, we're going to start looking at those intervening variables. And we do have some reporting, and I know this was one question. Basil will be coordinating the reporting that's due to SAMHSA and to the state. And I will also be helping with that. We do have a reporting tool that we will be releasing during the first training. And we can address that during training 1. And I do understand reporting is huge. We have to make sure, as you all know, that what we're doing, number 1, that we're doing something. And number 2, that we are actually showing where our community stands with specific data requirements. What's next after December is January through April. We'll be meeting twice, and we'll be completing assessment. We'll be doing planning and prioritizing and figuring all those out. Assessment and planning tools will be completed by the April training. And then we'll start delving into action planning and creating our action sheet, so that we know who's doing what by when, what we need to get that done, when will we have this finished. So you really have a nice action plan. So we have a lot in front of us. And then really, if we have any questions now, I'd be happy to answer them. We've had some good questions. Really, if you have any in-depth questions, those will be saved for our TA calls or emails, or like I said, I'm really available. I'm 100% on this project. I have no other projects. So I am all yours. If you need to call me, I'll give you my number right now. My telephone number, in case you have a question that's just burning, is 252-258-7383. And that is my cell number. I can't always promise that I'm going to answer a burning question at midnight. That's probably going to wait. But during the day, I might be in some meetings. But if something, I hope to get back to you as soon. I plan to get back to you as soon as possible. Weekends are pretty questionable. I'd sort of like to keep my office hours from 8 until 5 in non-working weekends. But if you have a weekend event or are doing something and it's really important, then you can at least try me. So any questions at this point? Because that's all I have for you today. So that was pretty exciting that we made it in 45 minutes. And I hope that I haven't rushed this, but if you're anything like me, you want to get the tools in your hands, you want to get the toolkits, review those in your own time and space. And what I recommend is that the coordinators review those first so that you could train someone on those, because in turn, you will be asking your partners that you think would be helpful with these tools to meet in your office. Or when I was filling out tools like this, when I was the executive director of the Pitt County Coalition, my president said, I can't meet in an office. I need to meet in a coffee bar. So we would go and have coffee, and so you have to sort of figure out where your partners are, but learn those pieces first, and then invite others, because they have different perspectives. They have data that you don't have. So, invite them to meet with you and help fill out these sheets. It's not just for you to fill out. It's not cheating if you invite someone from the hospital to come talk to you and fill in some data about how many young people are being brought into the ER for alcohol poisoning. So just familiar yourself first with these. Ask me if you have any questions, and then it's your job to train the people in your communities.
Elizabeth, we do have a question.
Yeah, sure.
To quickly review the items that were what items were emailed out already, and what items should be expected to be received soon.
The agency TA, technical assistance homework, was already emailed out, and that was due yesterday. And the homework will be going out tomorrow. And I will be sending out an email specifying, or probably late tonight because I'm in Raleigh tomorrow. It'll be sent out either this afternoon or this evening, the homework that is due for the first training and the toolkits. So what I sent out last week was the agency TA and to sign up for TA calls. By tomorrow, you will have the homework that is due. So that'll be the capacity and the assessment homework that is due the first training, December 3rd.
I assume that if someone didn't receive the original homework, they can email you and
yes,
get another copy. Yeah.
Please do.
Any other questions for Elizabeth or chat box items? Feel free to jump in via audio. Simply unmute yourself. We'll give everybody just a few seconds. You know, the old saying is 7 seconds in the classroom, Elizabeth. I think it's online via webinar, it's even a lot shorter. It's about 3 seconds. This webinar is being recorded, so we will, as soon as the video processes on my end, we will download, edit, then upload to the help desk and email out to everybody the actual link. For your staff, I know that you may have staff who was not able to be here today, and it will serve as a historical record as well. As Elizabeth mentioned, the online workspace we have created for PFS, we're pretty excited about. It's something new that long-term will decrease the amount of files being shuffled back and forth, but it'll also create a historical record from the very beginning. For you, the county, but also from the state perspective, a historical record of 4 years of documentation. Then in the very end, will prove very valuable for sustainability and evaluation measures. So that's a pretty neat process. I would ask you to start thinking about very, very soon, after next week, to be honest, we will ask each county who needs a workspace account and what's their names and email addresses. Again, in some counties, it may only be one person. If you're the primary point of contact and the primary staff, or as Patty asked, Patty may be the supervisor and have additional staff, and she wants to be able to see the material as well. So we'll be asking questions like that and setting up those accounts prior to the Winston-Salem event. If you have questions about the hotel process, or if you if you indicated you needed a hotel room to be a member of the hotel block, please let us know. If you're not sure, let us know. If you have any questions about those travel logistics processes, that's why we're here. I don't see any other questions, Elizabeth. So I'll send it back to you for final words.
Well, I'm just really excited about meeting everybody, getting started. I feel like we started, but now we have a training coming up, and I'm a face-to-face person, and I look forward to getting to know people over our November TA calls. Please sign up for those. and just bring your excitement and your enthusiasm with you in December. Thank you so much, and have a great day.
We have one other question, Elizabeth.
Okay.
And this is a question that may be undetermined. Of course, ECHO is the state block grant reporting system that regular block grant staff report into. And the question was, of course, will we need ECHO, will we be using ECHO for PFS as well?
I don't think so at this point, but I think you could. I've never used ECHO. I'm just saying that I've never used ECHO. I've never been a block grant reporter. And so you might be able to use that to, I will be sending you, in addition, I will be sending you data that I believe was taken down from some state resources. And I know that we won't be using ECHO, but you could use it with looking for data. Is that correct, Jamie?
It is.
Okay.
Data we can pull out of ECHO. Currently, we haven't set up ECHO on the back end for PFS use, and I haven't been part of any of those conversations. So I think Elizabeth's presumption is probably extremely correct at this point.
Okay, any other questions?
I don't see any more questions on my end, Elizabeth.
And if you do, just send me an email, give me a holler. I will find out the answer if I don't have it.
Again, thank you, everybody. And this webinar is complete, 9 minutes early. So congratulations, we've given you 9 minutes. And you should see an email from me in the next 24 hours or so related to the video link. Thanks so much.